Hey everyone, and welcome to the deep dive. ROP is something we all deal with, and today we're focusing on anti-VEGF treatments, so definitely relevant to your practice.
Absolutely, and it's evolving so rapidly.
Right, and to guide us through all this, we've got this awesome article by Dr. M. Elizabeth Hartnett.
Oh yeah, retinopathy of prematurity. Evolving treatment with anti-vascular endothelial growth factor. It's a great one, really dives deep.
Yeah, packed with insights. So I think most eye doctors know about ROP, but this article takes us way back to the 1940s.
Back when it was called retrolental fibroplasia, or RLF.
Right, RLF. Why is that significant for us now?
I think it reminds us just how far we've come, but also, how we can go wrong if we don't really understand what's happening. Back then, the babies were born maybe 2 months early, but now it's like 4 months.
Wow, 4 months.
Huge difference, and that totally changes how we approach treatment.
Definitely. Babies born that early, their retinas are still developing, right?
Yeah, exactly. The vasculature is nowhere near mature. So we're not just trying to stop those abnormal vessels, but we also have to be careful not to mess with the normal development.
Yeah, it's like walking a tightrope trying to get rid of the bad stuff without impacting the good.
Exactly. And the article goes through all those, historical treatments, cryotherapy, laser ablation.
Oh yeah, pretty intense stuff.
But that was standard for a long time. The thinking was destroy the avascular retina and you reduce those angiogenic factors.
It made sense at the time, I guess,
Yeah.
but obviously not ideal.
Right, lots of downsides. So then we get anti-VEGF agents.
Right, everyone knows VEGF and angiogenesis. But what about those initial worries? Like, would stopping the bad vessels also stop the normal development?
That was the big question. But it turns out it's not about blocking VEGF completely. It's more about modulating it, finding that sweet spot.
Uh-huh. So we got to be VEGF-Y careful. I
Exactly.
love it. But seriously, how do we find that sweet spot? What does the research say about, like, the right dose of anti-VEGF? That's what really matters in the clinic.
Absolutely. And the article covers some key trials. One of the big ones early on was BEAT-ROP, looking at bevacizumab.
What did they find with that one?
Well, they found a lower dose of bevacizumab actually worked really well. Like, it was better than laser in some babies with ROP in zone 1 or posterior zone 2 at reducing the need for more treatment.
So starting low could mean avoiding laser later on.
Potentially, yeah. But there were some concerns about bevacizumab too.
I heard some things, yeah.
Yeah, later studies found issues with ROP coming back, even retinal detachment sometimes, especially with higher doses or if treatment was started later.
Hmm. So timing and dose are super important.
Absolutely critical in these tiny babies.
Makes sense.
Yeah.
What about other anti-VEGF drugs, like ranibizumab?
Right. So the ranibizumab study compared ranibizumab to laser, and ranibizumab, it clears out faster than bevacizumab, so there was hope that it might be safer, less systemic effects.
Yeah, I got to think about those little organs still developing. So what happened?
Well, it wasn't totally clear if ranibizumab was better than laser, but a zero point 0.2 milligram dose seemed like a good option. And importantly, it didn't seem to affect those overall VEGF levels a month later.
Interesting. So it targeted the eye specifically.
Seems like it. And then there's the PEDIATRICS 1 study. They looked at less severe ROP.
Right, type 1.
Exactly. And they kept lowering the bevacizumab dose to find, like, the minimum that worked.
And what was it?
Get this, just 0.031 milligram. Tiny, right?
Yeah.
But it effectively treated the ROP over 6 months. Shows you how potent even those small amounts can be.
Wow, that's crazy, but it sounds like we still don't have all the answers, do we? What about those cases where the avascular retina sticks around even after anti-VEGF?
Yeah, that's a big debate. Some people say go for laser, get rid of it completely, reduce the risk of things flaring up again or detachment.
But wouldn't that go against avoiding laser?
Right. It's tricky. Laser might help in the short term, but then there's the worry about long-term stuff, scarring, visual field problems.
So we're back to balancing the risks and benefits.
Yeah. Always. And that just highlights why we need more research, especially on the long-term effects of both anti-VEGF and laser in these little eyes.
This has been so helpful. I'm already rethinking some things. But before we get ahead of ourselves, what about other new research going on?
Oh, yeah, there's so much exciting stuff beyond just dosage and comparing drugs.
Okay, let's hear it.
So one area that's really exciting is nutritional supplementation, specifically using something called insulin-like growth factor 1, or IGF-1.
IGF-1. Now, that's something I usually think of for, like, building muscle, not eye development. What's the connection to ROP?
Yeah, you're right. IGF-1 is known for its role in muscle growth, but it turns out it's also super important for the retina, especially for those blood vessels to develop properly.
Interesting.
And here's the thing. Studies have shown that premature babies, they often have low levels of IGF-1.
Hmm. So could low IGF-1 actually be part of the reason they get ROP in the first place?
That's what some researchers think. And if that's true, imagine if we could just supplement with IGF-1 and prevent ROP altogether.
Wow, that would be amazing. Any research to back that up?
Well, there was one study that looked at giving IGF-1 to preemies, but it didn't really show a big impact on ROP rates. But there are other trials going on right now, looking at IGF-1 for other problems preemies have, and those will be tracking ROP too.
So we might get more answers soon.
Hopefully. And it's not just about the blood vessels. There's also the whole neuroprotective side of things. That's another really promising area for ROP.
Right, we talked about how ROP can affect the development of the whole retina, not just the vessels. What kind of neuroprotective strategies are people looking at?
Well, there are a few different things. Some researchers are focusing on medications that could protect those delicate retinal cells. Others are looking at ways to change the environment, to make it less stressful for those developing eyes.
So it's about giving those little eyes the best possible chance to grow healthy.
Exactly. And as we learn more about how the vascular and neural systems work together, I think we'll find even better ways to manage ROP.
It's pretty incredible how far we've come from those early days of cryotherapy to now talking about preventing ROP with things like nutrition.
It really is. But it's important to remember that ROP isn't just a scientific problem to solve. It's a global issue, and not everyone has access to the same level of care.
That's a really important point. We've talked about how ROP can look different in different parts of the world. What can we, as eye doctors, do to make sure all babies get the care they need?
Well, I think first and foremost, we need to improve access to good neonatal care everywhere. That means making sure everyone is following the best practices for oxygen, for example. We know that can make a big difference in preventing ROP.
And training more doctors who specialize in ROP, especially in places where there aren't enough.
Absolutely. And technology can play a role too. Telemedicine, for instance, could allow specialists to consult on cases remotely.
So many possibilities. It sounds like a lot of work, but also a chance to really make a difference.
It is. And it's not just about treating ROP, it's about addressing the reasons babies are born premature in the first place.
Now you're talking. Preventing prematurity would be the best solution.
For sure. But it's complicated, right? There's so many factors involved.
So where do we even start?
Well, there's a lot of research looking into things like environmental pollutants, because we know exposure to those can increase the risk of preterm birth.
So creating a healthier environment for pregnant women and their babies.
Exactly. And there's growing evidence that things like poverty, lack of access to health care, social factors, those play a big role too.
So it's about creating a more just and equitable world for everyone, really.
Absolutely.
This has been such an eye-opening discussion, and I feel like we've only just scratched the surface.
There's always more to learn, but I hope our conversation has given you a better understanding of where we are with ROP treatment, what the challenges are, and what the future might hold.
It definitely has. We've covered so much, from the history of ROP to the newest anti-VEGF research, the debates about how to treat it, and even a glimpse into what might be next.
We talked about how important personalized treatment is, the need to think globally, and the role of research in moving the field forward.
And most importantly, I think we've been reminded that ROP isn't just an eye disease. It's a complex issue that affects so many babies and families around the world.
And it deserves our attention, our compassion, and our commitment to finding the best possible solutions for these tiny patients.
Okay, before we get too sentimental, let's take a moment to gather our thoughts. We'll be right back to wrap up this deep dive. All right, we're back and ready to wrap up our deep dive into ROP. It's been a long journey.
It has. From kind of fumbling around in the dark to now, it's amazing how much we've learned.
Yeah, we've definitely come a long way.
Yeah.
So for our listeners out there, all those eye doctors dealing with ROP, what are the big takeaways here? What should they be keeping in mind?
I think the biggest thing is you got to remember every baby is different. There's no one-size-fits-all approach to ROP.
Right. Personalized medicine, super important.
Absolutely. You can't just use the same treatment for every baby. You have to think about how severe the ROP is, where that vascular retina is, how healthy the baby is overall, so many things.
It's a lot to consider. which is why staying up to date on the research is so important.
Couldn't agree more. New studies are coming out all the time, helping us figure out what works best in different situations.
And that helps us make the best decisions for these little ones. And speaking of the bigger picture, we can't forget about the global side of things. Not everyone has access to the same level of care.
That's so true. It's a problem everywhere, not just in certain parts of the world. As eye doctors, we have a responsibility to do what we can to address those inequalities.
Absolutely. How can we help make that happen?
Well, I think sharing knowledge is a big one. We need to make sure everyone has access to the latest research and best practices. And, supporting training programs, especially in areas where there aren't enough ROP specialists.
Makes sense. And it's not just about training, it's also about resources, right? Making sure everyone has the tools and equipment they need.
Exactly. It's a multi-pronged approach for sure. But it's worth it because every baby deserves the chance to have healthy vision.
Well said. And that brings us back to the power of research.
Yeah.
It's amazing to see how much progress has been made, all thanks to dedicated researchers.
It's true. Research has taken us from those early kind of scary treatments to the more targeted therapies we have now. And it's what's going to lead us to even better solutions in the future.
So important to keep pushing those boundaries. So as we wrap up this deep dive into ROP, what's the one message you want our listeners to take away?
I think it's hope. Even though ROP is a tough condition, we're making real progress. And by working together, sharing what we know, and never giving up, I truly believe we can make a huge difference for these babies.
I love that. Hope is powerful. Well, I feel so much more informed and prepared to handle ROP cases now. Thanks for being here and sharing your expertise with us.
My pleasure. It's been a great discussion.
And to all our listeners, thanks for joining us for another deep dive. If you found this episode helpful, be sure to subscribe and leave us a review. And as always, keep those questions coming. We love exploring the world of ophthalmology with you. Until next time, stay curious, keep learning, and remember, we're all in this together. Let's make sure all those little eyes get the chance to see the world clearly.